The following skit takes place in a skilled rehab nursing facility. The scenario takes place after change of shift when the team has a huddle. It begins as the RN supervisor is explaining to the team the patients that have change of condition that needs to be monitored by all personnel. The RN in charge or charge nurse will be monitoring the staff and performing tasks in her scope of practice, including but not limited to phone calls to and from family and doctors, admissions, discharge, starting IVs, and giving IV medication and blood transfusions. The LPN will be monitoring blood transfusions, giving PO medication, doing treatments, patient teaching, assess and report any abnormal findings to the charge nurse. The CNAs will assist with the ADLs, turn in position, monitor, and report any changes in the patient's status to the LPN. The CNAs are responsible for taking vital signs, monitoring intake and output, and assisting with feeding. In this scenario, we have 3 CNAs taking orders from LPNs and those LPNs reporting back to the RNs. It is important to have CNAs who can help with monitoring because they are the ones around the patient the most often. The charge nurse who is to report to the nurse supervisor for any questions or concerns. The charge nurse also oversees by making sure everyone is on task and gives out the roles to the appropriate personnel. The charge nurse is also needed to be a witness on blood transfusions and making sure that the patient is all right post-transfusion.
Good morning, everyone.
Good morning.
Welcome to another wonderful day at West Coast University Hospital. I'm glad to see you ladies already in your uniforms. We have a very interesting shift ahead of us. We have 8 critical patients, but there's one I want to pay close attention to. She was just admitted to room 125. She has anemia and her hemoglobin is at a 6. So our admitting physician, Dr. McSteamy, has ordered 2 units of packed red blood cells to transfuse over 4 hours. So with this critical case, Marina, I'm assigning her to you. She's on your unit, and I need you to start the blood transfusion. This morning, I've already sat with the patient. I did a focused assessment. Her neuro status is intact. She's alert and oriented ×3. So she was able to sign the informed consent for this procedure. I just need you to go to the lab, pick up the blood, and when you're at the room within 30 minutes, call me and I'll come and do the verification process with you to start the transfusion as soon as possible.
Okay, great. Yeah, so I will call you when I'm at the bedside, when I'm starting the transfusion to make sure that every information is good to go. I'll also do the first vital signs at 15 minutes and check for any type of reaction also. So Ashley, I will have you take the vital signs, the pre-transfusion vital signs, just to get a baseline on the patient. Sound okay?
Okay, I'll get the pre-transfusion vitals and I'll report them back to you. And while I'm in there, I'll make sure that we have the live tubing and the pump as well to get everything started.
Great. And since Diana has a specialty in IV.
Oh, IV certified. Good for you, Diana.
So she's gonna start the IV for me, and also give PO medications.
Okay, I will do PO meds, and I will start IV and hand the normal saline. Guadalupe,
Yes.
I need you to help me with the measurement and documenting for the patient input, specifically breakfast and lunchtime.
Okay. Okay, I'm going to help in the patient feeding, breakfast and lunch. And I'm gonna call the dietary department to confirm the correct diet for this patient, because the last time I felt that this patient was like having a problem, little problem. She was complaining about the food. So, and then I'm gonna continue to measure the input and let you know the results, and then put it in the document.
Okay. Ashley, could you please help me reporting and documenting the output, the patient output?
And then
Nicole.
Nicole, I'm gonna have you do the vital signs at 30 minutes. And also, I want you to check the IV site. When you're there, also just make sure that there's no reaction, any type of reaction with that person.
Okay, so just to read back, you want me to do the vital signs at the 30-minute check mark? Check for the IV site for any redness, any abnormalities, and to verify that the patient isn't having any allergic reactions or anything like that, correct?
That'd be great.
Okay, I'm gonna need you, Dana, to please help me with checking the vital signs starting at the 1 hour mark till the 1 hour post transfusion in order to make sure the vitals stay stable throughout the process.
Okay, so what you want me to do is take the vital signs every hour, like during my shift, and then 1 hour post transfusion. Okay, so I will do that, and I will document if I see any change or any sign or symptoms for any allergy or something, and I will give you a report, so I will let you know.
Perfect, thank you.
Great, so then at the end, I will flush the line and make sure that the supplies go into the appropriate biohazard containers. Also, thank you guys for being compliant today. These are gonna be busy 4 hours, so let's make sure that we work together to get this done.
Yeah, and if anybody needs any information, I have some handouts you can grab on your way out in the break room about blood transfusion and what the side effects that we're looking for, any adverse reactions, anaphylaxis, and those type